started. It would be helpful for me if you'd hold your questions to the end. Next slide, please. My name is Betty Morse, and I'm the Technical Assistant Specialist, as Molly told you, at Children with Special Health Needs at the Department of Health. Children with Special Health Needs, the program supports Vermont children and youth with special health needs by ensuring comprehensive, culturally sensitive, community-based, and family-centered services. And it's a free program for families. We support children with complex chronic health conditions and/or developmental disorders ages birth to 21 and their families. The technical lingo is children and youth that have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions, and who also require health and related services of a type or amount beyond that required by children generally. At CSHN, we are a team of medical social workers, nurses, and other specialty providers who are experienced and skilled in working with children and their providers. CSHN provides a variety of services and supports based on your child and family's needs. We focus on your child while also taking a holistic, family-centered approach. We are there when you need us the most and in the background when you don't. And there are a variety of services and programs available depending on the needs of your child and family, including care coordination, technical assistance, children's personal care services, pediatric high-tech nursing, and pediatric palliative care. And I think we're already on the next slide. So this Children with Special Health Care Needs provides care coordination with a system statewide of care, a statewide system of care. Our medical social workers are a knowledgeable and dedicated resource in our communities. This visual shows you how the social workers may be connected in different ways to a family who has a child with special health needs and the child's provider. Next slide, please. I've put this map of Vermont with the 7 medical social worker regions noted. And I put a link on the slide where you can access the map through the CSHN website. The social workers have their contact information right on there. Next slide, please. So during this webinar, we are going to explore information on Vermont's Disabled Children's Home Care Program, also known as Katie Beckett. And for the duration of this webinar, I will only refer to this program as Disabled Children's Home Care, or DCHC. The agenda will include some information on who Katie Beckett was. We will look at criteria for eligibility, both financial and medical. We will touch base on differences between Dr. Dynasaur Medicaid and Disabled Children's Home Care. And there will be some tips for completing the application, the 205 ALLMED Non-Long-Term Care application. We will cover the yearly financial, renewal, and program medical reviews. And we're going to end with information on if you receive a denial and information on EPSDT. Next slide, please. Disabled Children's Home Care is a Green Mountain Care program that allows certain children under the age of 19 who have long-term disabilities or complex medical needs that require a high level of care to become eligible for Medicaid insurance, even though their family's income is above the financial eligibility level for Dr. Dynasaur. With DCHC, only the child's income and resources are used to determine the financial eligibility, not the family income. Having Medicaid enables children to be cared for by their families at home, even though they need the level of care that would be provided in a hospital or a residential center. Vermont supports Disabled Children's Home Care because we know that children thrive best in the care of their children and communities. Next slide, please. So let's talk a little bit about who Katie Beckett was, things as a lot of people refer to the application, also known as Katie Beckett. Well, Katie Beckett was a girl from Iowa that spent the first 3 years of her life in the hospital because of her complex medical needs. The time came when doctors said she could leave the hospital with proper support at home, but the Medicaid rules at that time did not allow for payment because of a requirement about the coverage of equipment in the home. Katie's parents advocated with local representative and congressmen, and this highlighted the family's problems and eventually gathered the support of Vice President George Bush and President Ronald Reagan. Discussions with Medicaid led to an exception to the home care policy, and in December 1981, Katie left the hospital and finally made it home. Next slide, please. And just in case you wanted to read more about the Katie Beckett waiver, here's the information on the 134 of TEFRA, the Tax Equity and Fiscal Responsibility Act of 1982. This meant families across the nation would have a way to access Medicaid benefits for their child with complex needs. Oh, there's my phone. For the child with complex needs when their family income was above the federal poverty level for Medicaid for children. Next slide, please. To qualify for disabled children's home care, a child must first live in Vermont and meet the financial and medical criteria for the program. Let's look at those. Next slide, please. For financial eligibility, the magic number is $2,000 for monthly income and resources for your child. The child's family's income is not counted and resources are not counted. Only the child's income and resources are counted. The cost for care in the home has to be less than the cost in a hospital or residential center. Next slide, please. The institutional level of care is a term you will come to know. There is a wide range of services and supports needed by children with special health needs to live in the community, such as nursing, home health care, personal care services, medical equipment, medical supervision, therapies, transportation, care coordination, case management, to name some. Your child must qualify under the Social Security definition of disability. I included the link to the Social Security Administration's Blue Book of Childhood Listings. The 15 sections contain medical criteria that apply only to the evaluation of impairments in children under age 18. Example of headings include low birth weight, neurological disorders, cardiovascular system, hematology disorders, respiratory disorders, cancer, and mental disorders. The childhood listings are Part B. There is a listing of adult impairments listing, Part A, on the SSA website. You will need to look at this listing for your children after their 18th birthday. That's the Part B. Part A. Part A is adult, Part B is children. Looking at the criteria in these listings may give you a better understanding of the medical documentation needed and if your child might qualify for the DCHC program. Next slide, please. I'm not going to go into depth about the Dr. Dynasaur Medicaid in Vermont. I have just a couple of slides so that you will have a base understanding of Dr. Dynasaur Medicaid and in comparison to the Disabled Children's Home Care. In a moment, I will give you information on a webinar that explains Vermont Health Connect programs, including Dr. Dynasaur in great detail. I will mention at this time that the Green Mountain Care is working toward an online application for the Disabled Children's Home Care. And at this time, the call center is doing a project trial that allows some assistance with this application by phone. It's generally a paper application, as it's noted up above between the two. Children under the age of 19 for Dr. Dynasaur, same as Disabled Children's Home Care. The pregnant women are at 213 of the federal poverty level with that extra 5% disregard. And household income for Dr. Dynasaur is at 317 federal poverty level with that extra 5% disregard included. There may be a monthly premium, although during the state of emergency, that's been waived, applied, and renewed through Vermont Health Connect. And the Katie Beckett, age 19, only the child's income and resources are counted, must require an institutional level of care. Like I said before, must qualify under the Social Security Administration definition of disability, and a paper application package and renewal through Green Mountain Care. Next slide, please. This table shows the 2020 federal poverty eligibility levels for Medicaid for children and adults. Across the top, in the lighter boxes, you can see the headings Medicaid for adults, pregnant women, and children under 19 / Dr. Dynasaur. I want you to draw your attention to the vertical dark green column on the left, where the household size with the number of people up to 8 are listed there. On the right side, in the white column titled Children Under 19, you will find cascading down the monthly household incomes. So if you were a family of 2, you would put your finger on the green column on the left on the number 2 and look across to the white table on the children, to the box under children under 19 to see that the monthly income of $4,554.85. This means if you earn below that number, your child could qualify for Dr. Dynasaur. Above that amount, and your child will qualify for Disabled Children's Home to access Medicaid. This monthly household income for a family of 4 for Dr. Dynasaur is $6,921.20. Above that, for your child to access Medicaid, they would need to qualify for the Disabled Children's Home Care. Use this chart to help you think what Medicaid program your child may qualify for. And you can find this table on the Vermont Health Connect website. Next slide, please. So as I mentioned earlier about a wonderful webinar that went into detail about Vermont Health Connect and a place to learn more about Dr. Dynasaur. It was presented on October 1st by Victoria Jarvis, who was the program manager of the in-person assisters. It was an awesome webinar. These links are listed on the Vermont Family Network's website, and I encourage you to check it out. Next slide, please. It helps to get the information you will need for filling out the application ready ahead of time. It makes completing the application smoother if you don't have to stop to go look for things. So for everyone in the household, on the left, I've given some suggestions for things that you can collect, like Social Security numbers, which you'll only need to give the child you're requesting Medicaid for, but you can give them all if you want. Employment information, insurance cards. For your child applying for the Disabled Children's Home Care, you need to collect more things to have them ready to fill out the different parts of the application, such as educational provider information, height and weight of your child, names and phones and addresses for medical providers. And most of this information will be used to fill out the disability social report, the Child 211C, and is used to determine eligibility for this program. We will talk about this document later in the webinar. Next slide, please. For those who may be asked to provide proof of citizenship and identity, if the Department of Vermont Health Access cannot find you in the state and federal records, some of those federal records and state might be like the Department of Motor Vehicles or birth records, because they need to know that you are, when you're applying for your child, that you are who you say you are and your child is who you say they are. They need to know that you're a citizen of the United States and that your residency is Vermont. So you can attach, excuse me, copies of these documents to the application if you wish, or wait for them to contact you for them. I would suggest waiting until they ask for them. These are important, individually sensitive documents for you and don't need to be shared unless you have to. Next slide, please. So there it is, the 205 ALLMED application for health coverage and health paying costs. And as of this date, I put that on there because I don't know how long this will be on the website of VFN, but it was updated just this month, October 2020. And there may be future updates. It's always good to go. Well, I'll have some links in here where you can go to find it. I would suggest filling out, there's a a series of documents to fill out for the application, but I would suggest filling this one out first. And I've put a picture of the cover page, and it is marked as I on the form. You will notice up in the top right-hand corner written that this is the 205 ALLMED Non-LTC, which means long-term care. It is, and this application is color-coded and has many explanations about filling this out or what something means as you go through the application. So I think they really put a lot of thought into when they were putting this together to help simplify this document, to make it as easy as possible for you, because there is information that they have to collect that's federally mandated that they collect. This application, one of the reasons it's lengthy, is it's used for more than just applying for disabled children's home care. With this one application, your family can be screened or see what coverage your family might qualify for, such as affordable private health insurance plans that offer comprehensive coverage through Health Insurance Marketplace, Vermont Health Connect. If you would qualify for a tax credit that could lower your premiums for health coverage in that marketplace. It also screens for Medicaid for children and adults. This includes Dr. Dynasaur. They can screen you for pharmacy programs and the Medicare savings programs. And of course, they can screen for the program we are talking about today, Disabled Children's Home Care, Katie Beckett. And this program falls under the Medicaid for the aged, blind, and disabled. For this program, you will need to fill out the supplement, but we will talk about the supplement and completing it for your child's DCHC in a later slide. It is important for you to read this cover page as it has information for you, such as why they need the information they will be asking, that there are interpretation services that are available, and what happens next. It is suggested that if you don't have all the information they ask, to sign and submit the application anyway. They will follow up with you about next steps to get that information. Next slide, please. I think we're on page 18. Should say page, there we go. Very good, thank you. These two pages, II and III, are about your rights and responsibility, and it is important for you to read these details. Page II, which is up there now, has information about your right to a timely decision. I pulled that paragraph out for you. In most cases, a decision about your application must be made within 45 days for Dr. Dynasaur and 90 days for a disability-based decision, such as Disabled Children's Home Care. If you do not receive a letter of decision in that time period, you can call their customer service at 1-855-899-9600. The customer service number is also noted on the cover page, the one we just looked at of this application. Also written on this page is information about your right to appeal. If you disagree with their decision, or if you've not heard from them within the Dr. Dynasaur 45 days or DCHC 90 days, I have pulled out this section because you could ask for a state fair hearing. Any eligibility notice you receive will give you information about your appeal rights. You must appeal within 90 days of receiving the eligibility notice. If waiting on a state fair hearing might do you harm, you can ask for an expedited appeal, and they may decide your appeal sooner. It usually takes 7 days for an expedited appeal, although it may take longer for Disabled Children's Home Care because there's so many details. To appeal, you can call customer service or write the Human Service Board. It notes that you should attend the fair hearing, and you can have someone else speak with and for you, like a doctor, a friend, or a lawyer. It also gives you the contact information for the healthcare advocate who may be able to help you. This page also talks about rights of people with disability, information for non-citizens, what to do if you are being discriminated against, and your rights for confidentiality. How to use your information and your duty to report changes, which I have pulled out on this slide also. Changes in your income, primary health insurance, additional or loss of household members must be reported. Also, if your address changes, there is a marriage or divorce, pregnancy, or if you move out of the state. There's more information about the disabled children's home care and what you need to do on the next page. Let's look at that. Next slide, please. This is page III, and it gives you information about fraud, agreement to release medical records, agreement for Medicaid to pursue third-party payers, and if a child in your household gets Medicaid and special education. If you sign this application, you give permission to your child's school district to bill Medicaid for the services listed in your child's individual education plan, the IEP. The pull-out box shows that this signed application gives the Department of Vermont Health Access permission to verify income and resources. And this is done utilizing their electronic asset verification system. They will verify your resources with financial instructions for the purposes of determining your child's eligibility for Medicaid. You do have a duty to report changes about your resources or assets, your child's resources or assets, as well as your own. In addition to the ones noted on page II, for disabled children home care, you must report when your child's monthly income and resources go above that magic number, the $2,000, such as if your child gets a lump sum payment in 1 month. You can call customer service at 1-855-899-9600, which is noted on the cover page, or you can print and mail the report form, and it's form 200 GMC to DIVA. I have put a link to the Green Mountain Care page where this form can be found. You can also fill out the form on your computer, save it, write in it, and upload it to DIVA using the instructions found on that page as well. Next page, please. So let's get down to the doing of the application. We're going to look at page 1 of the 205 ALLMED Non-LTC. And this is the green step section. Page 1, step 1. They are asking for information about you, not your child. And for providers on this webinar who remember the past application, the 202 Med, the way you fill out this form is different. The parent guardian information goes here. This person listed here will be the person who talks with Medicaid about this application and may have future conversations with Vermont Health, Medicaid. And for Dr. Dynasaur, it could be the person who may file an income tax return and list the child as a dependent. Your Social Security is needed as you are the applicant. Providing your Social Security number is helpful, even if you don't want coverage, because it's part of the needed application process. Next page, please. Moving on to page 2, step 2, person 1, still in green. This is yourself, the same person listed on the page, who was listed on page 1. And questions 1 through 7 include your name, date of birth, marital status, and that Social Security number again. You do not need to provide immigration status or Social Security numbers for family members who don't need health coverage. By law, they are required to keep the information you provide safe and private. And they really only use personal information to check if you're eligible for health coverage. So if you, as a parent guardian, are applying for health care, I would suggest putting your Social Security number there. It's helpful to them for organization and it helps speed up the process. Question 8 is about your federal income tax. And question 10 asked if you're applying for health coverage. So if your answer is no, you can skip to page 3. So if you're not, as a parent guardian, applying for health coverage, you put no and skip to page 3. It's the current job and information, which is where I think most of the parents and guardians will be going next. But if you do need to apply for coverage for yourself as a parent guardian, then you would complete questions 11 through 14 for yourself. Next page, please. So this is page 3, step 2, person 1, still green, and you complete questions 15 to 20 if you're applying for health care for yourself. You do not need to fill these out if you're only applying for DCHC coverage for your child. So we'll go right to that. Under the current job and income information, you check the box about that matches your employment status. Are you employed? You would answer questions 21 through 33. Are you self-employed? You would continue to questions 32 to 33. Or not employed, in which case you would continue to question 33. And these questions and how to answer them are really clearly marked on the form. Next page, please. So this is page 4, step 2, person 1 continued, still in the green section. And you would put, as yourself, parent guardian, would put additional job information and other income in this month here. And under deductions, there's a box where you can check none if you don't have any deductions. And you could, some of the deductions you could list there is alimony paid and information on that, student loan interest and other deductions. And this is where you would list any deductions you were able to claim on your 1040 federal income tax return in the adjustments to income section of Schedule 1. And that's all written right on there so you can see. The yearly income question number 36, you only complete if your income changes during that year. And that's the end of yourself as the parent guardian's person 1's information. Next slide, please. So page 5, step 2, person 2, still in the green. You will fill out step 2, person 2. The questions should look familiar. There are just a few differences from what you just did for yourself as the parent guardian. And you will fill out the next step 2 persons for everyone in your household, your spouse or other parent of the applying child and your other children. I would put the spouse or the other parent of the child next, and then the other children after that. Included in this application are step 2 pages for only person 1 and 2. You will need to print more if you have more than 2 family members. I put a link there where you can download step 2, person 3 and 4 from the Department of Vermont Health Access website. If you need more than that, just print 3 and 4s over again, cross out the person number at the top of the pages and make it the person number that you need. Next slide, please. Step 2, child applying for disabled children's home care. And this is the step that you're doing, especially for the child that you're applying for the disabled children's home care for. And I wanted to draw your attention to the step 2 person number. And I wanted you to note the question 12A, and I've pulled that section out. So let's say your child who's applying is would be person, we'll say 3, and have a physical learning, and it says, does person have a physical, learning, or emotional health condition that causes them regularly to need help with some or all of their self-care activities, like bathing, dressing, eating, reading, daily chores, etc. if you are applying for disabled children's home care for your child would have one or some or all of these, and you would check that box, yes. This reminds you that you need to do the Medicaid for the Blind and Disabled blue supplement of this application. It starts on page 12, and we will be reviewing it later. It also notes if you check the box yes to skip to question number 13. Next slide, please. So this is page 8, step 3, your family's coverage. And this page is collecting information about what insurance your family may already have. Question 1 asks, is anyone listed on this application offered health coverage from a job? If you answer yes, it prompts you to fill out Appendix C on page 19. Question 2 asks about currently enrolled healthcare coverage, and it lists some choices that you can check the box and then write beside it who is covered. You will note that Dr. Dynasaur is one of the choices, because your child can have Dr. Dynasaur already and still apply for disabled children's home care, especially if you think your income is going to rise above that disabled children's home care eligibility level. When you have, and you can apply even if your child has a primary insurance and want Medicaid as secondary, and I should probably explain that better. Whenever a child has Medicaid and a primary insurance or insurance that somebody gets through work, that insurance that you get through work will always be the primary insurance, which means people, doctors, and where you get your medical equipment from and your pharmacy, they will all submit to the primary insurance first, and Medicaid always is secondary. So if you have insurance, you would fill in this information under questions number 4. Next slide, please. Page 9, step 4, still in green, household special circumstances. This page is about certain life changes within the past 60 days, like did your household gain a dependent? Did someone get married? Did you just recently move to Vermont? And question 5 is important to answer if your family has just moved here from another state, or if you have taken over guardianship for a child from another state who has come to live with you. Question 7 asks about changes someone in your household has experienced in the past 60 days, such as did you become a U.S. citizen or eligible or have become eligible immigration status. Next page, please. Page 10, step 5, future eligibility. Still in green, still in the green section. Step 5, determination of future eligibility using electronic data sources. You can choose 1 to 5 years. I recommend checking the 5-year box if you want to give Medicaid permission to check these resources for you. Step 6, if you're Indigenous peoples or have received services from Indian Health Service, if yes, it reminds you to complete Appendix B. Step 7 asks about incarceration, and step 8 gives you the mailing address for Dr. Dynasaur and reminds you to sign and date the next page. Next page, please. And there it is, page 11. It is important to sign and date this application. It will be returned to you if either are missing. Before you sign, read the information about signing on behalf of a minor child or incapacitated adult, and that's the word they have on there. Just below your signature, you would put your name again and fill out your contact information. Down below the orange bar, the big orange bar there, you will see the box where it asks if you will fill out the supplement for aged, blind, and disabled, and you would check that box, yes. Next slide, please. On page 12, we move into the section coded blue. We just completed the green section, so we move on to the blue section. And this is the supplement for Medicaid for aged, blind, and disabled. At the bottom of the page in a box are instructions for filling out the blue supplement. Please note, if you have more than one child in your household that you're applying for disabled children's home care, on this application, you will need to complete a blue supplement for each of them. Next slide, please. Page 13, step 1, information about you. This is information about your child. It's not about the parent or guardian. This supplement is all about the child. This supplement is for information about the child. You should put your child's name here and check the DCHC box. Step 2, your child's resources. Check the appropriate boxes and fill in the resources, if any. And the very bottom there, it asks about money earned from working person with disabilities. And I'll just give you a brief. Vermont's Medicaid for persons with working disabilities program was, I think it started around year 2000. And it's known at the federal level as the Medicaid buy-in program. It allows many people with disabilities to work while keeping or obtaining Medicaid coverage for which they might not otherwise qualify due to higher incomes resulting from employment for people with disabilities. And it helps them achieve community inclusion through employment and achieve greater economic dependence. And I just want to explain that for anybody who might have children who are older and are working. This could be an answer for them. Next slide, please. Page 14 is more questions about your child's resources. Does your child have life insurance? It asks that question. It asks if they have a Vermont Able account. And just a note that Vermont Able accounts are not counted as a resource. They don't count against as income or a resource. Resources are like savings accounts, education accounts, college funds, stocks and bonds, saving bonds. Remember that you only have to put these down if they are owned by your child and are in your child's name. You will need to know the account numbers and the present value. And towards the bottom of the page is additional income. Because this is a form that's used for many ages, it asked, did anyone get paid for taking care of children or providing room or meals? And if no, just check that box, no. Moving on to the next page. Page 15. Question 3 asks for additional income. And you would list any of those additional incomes that you have. And I just wanted to note that one of the ones listed there that they want information on is supplemental security income, SSI, or any cash received. And question number 4 is important. They want to know about if your child isn't showing any income or resources, which most of our young children don't. They want to know how their daily living expenses are being paid. And on question 4, you would just write, because it's in the voice of the child, I am 3 years old, or however old your child is, and my parents pay my daily living expenses. It could be the child's guardian who pays the daily living expenses, but you have to tailor that answer to the need of the child. Step 4 is asking about expenses, and you would list any medical expenses that have not been covered by any primary insurance, like vitamins, diapers, pain relievers, things like that. Next slide, please. Page 16. You would want to sign and date the supplement. You have to just sign what you just filled out, and you'll be signing by the first big red X up there. You'll be signing as a signature of a person signing on your child's behalf. They will not be able to process this request without the signature and date. And they will send this back to you to sign and date if it's not. Next slide. We're now into the orange section. It's coded orange. It's page 17, and it is the authorized representative form. At the top, you put the person one's information. That would be the parent guardian, where requested, and put the last 4 digits of your Social Security number. When I do a disabled children's home care application, above the parent guardian's name, I add the child's name and last 4 digits of their Social Security number for the child that I'm applying for the disabled children's home care for. You can choose an authorized representative and put their information on this form. Someone who has helped you with the application, or someone you would like to speak with Vermont Health Connect, Green Mountain Care for you. You can also choose an alternate reporter with this form. If you would like someone else to get a copy of notices about your application and coverage the same time as you do. And again, there's a place to sign and date. That's right, I think it's number 10 at the bottom. And you would want to sign and date that as a parent guardian. Next slide, please. We move into the coded brown section, which is Appendix B, and you complete this appendix if you or someone in your family is an American Indian or Alaskan Native or has received services from the Indian Health Service. Make sure your family gets the most help possible. Next slide, please. This is page 19, and it's coded a lovely olive color. And this is Appendix C. They want to learn about your health coverage from a job. If this is difficult for you to fill out, ask the human relations person at your job to help you fill out this form. They are generally very familiar with the health plans offered at your job site. And I did want to point out about the minimum value standard, because they do ask if your insurance covers meets that. And let me read to you what they've written across the bottom to help you understand that. A health plan meets the minimum value standard if it pays at least 60% of the total cost of medical services for a standard population and offers substantial coverage of hospital and doctor services. Most job-based plans meet this value standard. Next slide, please. And here we are. We're done with that section of the application, and we're moving into the disability social report, the 211C child. And this is the document that Disability Determination Services will use to gather medical records to determine if your child meets the medical criteria for the Disabled Children's Home Care Program. And this form has not changed since 2016 that I'm aware of. Your child's name goes in question A, and your name as parent guardian goes in number 3. This document is all about your child's information and the providers, doctors, therapists, and educational staff your child has and is seeing. You will document hospital stays, evaluations, and other pertinent information about your child's medical, developmental, and mental health. Be thoughtful and complete with your answers. You can attach medical records to the application or wait for DBS to send for them. If your child has had multiple hospitalizations or assessments, you can always write "see attached" by the question and include a spreadsheet of this information with this form, because that may be how you keep it to keep things straight. And so just makes life easier for yourself, and just attach a copy. Remember that DDS determines if your child is disabled for the purpose of, and if they meet the medical eligibility criteria for the Disabled Children's Home Care Program. I think I want to go back and say, instead of saying they, if he, she, or they meet the medical eligibility criteria for the Disabled Children's Home Care Program. They make this decision on records and information that they can review. This makes what you write in the 211C child really important, because the information they will be reviewing will be coming from the providers, clinics, and hospitals that you document on this form. You cannot find this form online, but you can call Green Mountain Care Customer Support Center, your CSHN medical social worker, Vermont Family Network, or myself for a copy to be mailed to you. Next slide, please. And here we are on the Form 212D, the Medicaid Disability Information Release Authorization. And this form is the release for disability determination services to be able to get those needed medical documents that we just talked about from the previous form. You should review this form to know what you are signing. And in the bottom part of the form is where you'll be signing and putting your address and contact information. There is a box to check if you are signing for your minor child, and if you are the court-appointed legal guardian or other relationship. And if it's another relationship, they ask you to define what that is. If your child is age 14 or older, there is a line for the child to sign. They have to put their name. They should sign however they are able, whether they print it, whether they cursive, or they sign with an X. If your child does not sign this form, it will be returned to you for signature, and the eligibility process will be on hold until that is returned. If there are signatures with an X, there will need to be witness signatures, and there's a place for that. And don't forget to put the date down when you sign, because they'll turn this form as well for that, for not having that. Next slide, please. I included the Medicaid request for retroactive assistance, the Form 202A. And you can, if your child has unpaid medical bills from 3 months prior to when you send in this application, you can use this form to request those retroactive Medicaid. You can request retroactive assistance for medical bills from the 3 months prior to the month Medicaid receives this request. You fill this out using the child's information, just like the blue supplement. I like to write across the top of the form that this goes with the DCHC application, and I include it with the application if you need if you are requesting retroactive coverage. This form cannot be found online, but you can call Green Mountain Care Customer Support Center, your CSHN medical social worker, Vermont Family Network, or myself for a copy to be mailed to you or emailed to you. Next slide, please. Additional documents. Copies of your child's medical records that document your child's disability. I would recommend that you document your parent view of a day in the life of your child. You are the one who knows their child best 24/7. This is your chance to get your knowledge about your child included. This can be difficult as you will be focusing on your child's challenges, not their strengths. For this document, you will want to think about a 24-hour period of what you and others do for your child that is above and beyond what is done for other children of the same age group. You will need to think about that extra help, the therapies you carry over into home, the support, the mentoring, the cueing, the reminding, the accommodations that you have to do. But I know they've become routine for you, so really think about and document those. You will need to include documentation of his daily living skills, such as eating, sleeping, and dressing. What nursing care do you provide? And observation of behaviors and reactions are important, and you should supply details. This could be in a letter or document form. If you're not a letter writer, you could use instead the Social Security Administration's child function reports. They come in different age groupings and they break down the functions for your answering. And there is plenty of room for comments, and I encourage you to comment. You can also attach additional pages if more room is needed. I sometimes find that the Social Security links aren't working, but the name of the form is there. And if you copy and paste the form names into your web browser, it will bring the form up for you. I would obtain and include letters from service providers about your child's disability and how it affects them. A letter written by a child's pediatrician or primary care doctor is helpful. The pediatrician is the leader of your child's healthcare team and along with you provides your child with a medical home. You could ask your pediatrician to write a letter that outlines diagnosis, prognosis, specialist services, and level of care your child needs. He can attach documents and office visit notes in lieu of a letter. Ask your doctor to include how your child's impairment affects his functioning compared to that of other children. Next slide, please. And before you mail, it is important to make a copy of the entire application. You have spent a great deal of time filling out everything, and you want a copy in case the application gets lost. A copy is also handy if you need to speak to Medicaid about this application, and you'll have that information right at your fingertips. Next slide, please. Here's the mailing address and a recap of the application documents that we've gone over. And I would recommend checking each document again, although you may have done so when doing the copying, just to make sure all those forms are signed and dated. Next slide, please. During the eligibility process, your child will be screened for Dr. Dynasaur first, and if found eligible, your child will receive Dr. Dynasaur while the Disabled Children's Home Care is being processed. If your child is approved, you will be able to choose the Disabled Children's Home Care or to keep Dr. Dynasaur. There is no open enrollment for Disabled Children's Home Care program. You can apply for your child at any time of year. And I put that 30 up there because I know they have 45 days, but it usually doesn't take them more than 30. The eligibility renewal process for Disabled Children's Home Care can take up to 90 days. The time frame varies depending on how quickly your medical sources respond to requests for records and the need for special examinations. Some determinations may take several months. And once Disability Determination Services has made a determination, you will be notified of the decision. Next slide, please. Need some help filling out this form? Here are some ideas. Green Mountain Care Health Access Member Services, that's the call center that can help you with questions around application, benefits, coverage, insurance, and providers. The in-person assisters are professionals who are trained and certified by the Department of Vermont Health Connect to help Vermonters enroll and maintain health coverage through Vermont Health Connect or Green Mountain Care. Your regional medical social worker, Vermont Family Network, whose mission is to empower and support all Vermont families of children with special needs. You can also talk with your child's case manager, social worker, care coordinator, nurse. If they can't help you, they can guide you to someone who can. What is important is that you get the assistance you need. And I'll quickly go over, next slide, please. I'll quickly go over the yearly Disabled Children's Home Care Program financial review. And this is done yearly. You'll receive the 202 Med review form about 6 weeks before your child's renewal date. Providers will recognize this form as the one we used to use to apply for this program. Parents and guardians will fill it out as if the child was filling it out and the child's income and resources, not the family's. There is a timeline for completing this and mailing it back. It should be noted in a letter. It is best to complete it and get it in as soon as possible. The form and its information will be reviewed by the Health Access Eligibility and Enrollment Unit to verify that your child's income and resources still meet the financial eligibility of this program. You will receive a letter in the mail letting you know of the renewal decision. If the child is found to be financially eligible, they will enter the renewal in their database, and that database is where providers will look to see if the child is Medicaid eligible. The medical review is required. Next page, please. The medical review is required periodically. They need to ensure that the children receiving Disabled Children's Home Care continue to meet the criteria of the program. The initial Disabled Children's Home Care Medicaid decision letter that you receive will note when the medical review will be. Each disabled children's home care Medicaid decision letter will have that information listed there. It's good to keep that letter. Next slide, please. So the review by the Disability Determination Services, you will receive, and it's the same form as we did in the application, the 211C. You filled out the same way. They're just looking for up-to-date information to see if your child still qualifies for the program. And I put a link into on the slide so you can contact DDS in case you want to call and ask how your child's case or renewal is doing. You can ask them what records they are waiting for, and then call those providers yourself to ask them to please hurry up with the records. Next slide, please. If you receive a denial letter, read that letter carefully. It will give you information on how to make an appeal or ask for a fair hearing. Vermont Family Network's Family Support Health Consultants can look over the denial and letter with you to talk about the appeal process. The healthcare advocate can talk with you about the denial and may be able to advise and provide representation about your appeal. They like to hear from you before you ask for an appeal, so what I would advise calling them when you receive the denial letter. I put some helpful links in there for more information to help you gain knowledge about appeals and fair hearings. One is from the Green Mountain Care, the other is from the Human Services Board and has their address, and the last one is information from Vermont Legal Aid Healthcare Advocate on how to prepare for an appeal, fair hearing, and what to expect. Next slide, please. I'm just going to take a second to talk about EPSDT. That stands for Early Periodic Screening, Diagnosis, and Treatment, and it's the Medicaid benefit that provides comprehensive and preventative health care services for children under age 21 who enrolled in Medicaid. And EPSDT is key to ensuring that children and adolescents receive appropriate preventative dental, mental health, and developmental and specialty services. Next slide, please. States are required to provide comprehensive services and furnish all Medicaid coverable, appropriate, and medically necessary services needed to correct and ameliorate health conditions based on certain federal guidelines. This is a Medicaid benefit that makes sure your child receives what is medically necessary for them. Don't be afraid to use that EPSDT word. And I have included a link to Medicaid.gov if you would like to learn more about these benefits. Next page, please. I would like to take this time to thank the assister team trainer who did a training on this new application for the CSHN staff last October. The assister team, the Department of Vermont Health Access Enrollment Unit, and Disability Determination Services have been very helpful this past year as we used and learned this new 205 ALLMED non-long-term care application. And I hope you have found this presentation useful to you, and thank you for attending. And I'm not sure if we have any time for questions, but
I think it's okay to go just a little bit over. If people have to hop off, just a reminder that this is being recorded, and so you can always listen to the end for the questions afterwards. And we just have a few questions, Betty, if you don't mind. Someone asked, they had just received the 205 ALLMED with a version date of April 2019, and is that still okay to use? Is that up to date?
Who did they? We don't know who they received. I would say because they just updated the form this month that it's okay to go ahead and use that. But future ones they can download right from the website or get it from the rest of us.
Great. And then another question was, will supplying medical records with the application help speed up the processing, or is that just sort of expected that people are going to do that either way?
I've known it to speed up the process. It is hard to share your records because they're going in one place and then they get it ready and send it on to DDS, who really uses those medical records for review. So you have to temper having those records go through another place to get to where they're needed. So it's all about who you want to see those records. But yes, it will generally speed up the application, especially if they're very specific records.
Great. Can the application and forms be sent via certified mail? Don't actually know what certified mail is, if I'm being honest.
I think you can mail them any way you would like. I do know a person who sent them certified once and they still got delivered to the wrong address.
Okay, and then we have, what happens if we go above the monthly income during the year? I'm not sure I understand. Maybe they might be thinking of Dr. Dynasaur, or I don't know if they meant the child's monthly income goes above it.
If you go above the Disabled Children's Home Care, that monthly $2,000, the magic number monthly, then you would have to let Green Mountain Care know.
Okay, and then what is the definition of an institutional level of care?
That's the level of care that a child would receive in a nursing home, a hospital, a mental health treatment center.
Okay. If someone's child is up for a renewal for DCHC, but they haven't received the renewal form yet, which usually happens by now, should it be assumed that the child is covered until the pandemic is over? Have you heard of a backlog in some of these?
Well, it's not backlogged. Excuse me, I need more coffee. There is not so much that they're backlogged. It's during the pandemic they waived the renewals, so nobody is supposed to get a financial eligibility renewal until after the state of emergency is over. They are still doing the medical determinations though.
Okay, let's see, a couple of others, I think. So going back to, I think, the green section of the form of the 205 ALLMED, under step 2, person 2, would you fill that out for a parent who lives in a separate household? So if, say, the parents are divorced and they, are both contributing financially, would you include them as a member of the household?
If the child, let's say parent 1 lives in this house and parent 2 lives in another house and they're divorced or apart for whatever reason, and the child lives with parent 1, parent 1 could fill it out as part of their household. They wouldn't have to include the one that doesn't live there.
I'm just checking I haven't missed any. Let's see. If your child qualifies for Dr. Dynasaur or has other health insurance, does that hurt the chances of being accepted for Katie Beckett?
Can you say that again?
So if you have alternative insurance, say you are also eligible for Dr. Dynasaur, or you have private health insurance, will that hurt your chances of having disabled children's health care denied, or rather, will it hurt them at being accepted?
Because you have primary insurance? No. And it wouldn't matter if your child has primary insurance and Dr. Dynasaur. That's not going to hurt your chances for getting disabled children's home care too if they qualify.
Okay, great. I believe I got all the questions. I'm just making sure. So thank you all for submitting those. And you have Betty's information there if there's follow-up that needs to happen.
I'd like to make sure that the links get out to people because I think I noticed there might be trouble with links. So if there's anything I could do to help with that, Molly, let me know.
Sure, yes, I will be in touch and we'll figure out a way to make that happen. So thank you, Betty, so much. This was extremely informative and everyone is already giving you glowing reviews in the chat here. You'll see a link to an evaluation in the chat from Janice, and that will also pop up when we end, hopefully, assuming everything goes to plan technology-wise. So when we end, that will pop up. Please take just a few minutes to complete that. It helps us make improvements and fulfill our grant requirements. We have a couple more workshops coming up in our free online learning series. On December 2nd, child psychiatrist Dr. Dickerson and Chava will present Family Worry in 2020, What's Not to Worry About. A link to registration is on the homepage of our website, and you'll also find our fall SIB Shop schedule on our homepage. SIB Shops are a fun program for brothers and sisters of children with disabilities or special health needs. We have tons of information on our website. Getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page, which is only for parents. The name of the closed Facebook page is Vermont Families of Children with Special Healthcare Needs. And you can also sign up for our monthly e-news or check out our YouTube channel. And I believe Rachel has already shared the link to Dr. Dickerson's workshop on the 2nd. And yeah, we're here to help. So please contact us by phone or email, which is both are on our website. We're having a little technical difficulty with moving the slides forward to our contact page. So I apologize for that. But thank you everyone for being here, and everyone have a great day.